In this video, we're going to go through some of the Pilates leg lift sequences. So leg lifts are traditionally done with the legs fully extended, so you're working on this principle of long levers being involved with the weight of the legs. The leg lifts can cover both abduction and adduction of the hips, that's moving away from the body and towards the body. So there's a lot of things which can be used, and in the more difficult levels you can combine both of those and get some really nice side planking going on in some context where you're utilising all sorts of muscles which are very important for core stability. Like lots of side lying exercises, because of the long levers involved and the relative weight of the legs, these exercises are probably not appropriate for people who've got acute hip pathologies going on. So predominantly things like lateral hip pain, which are characterised by gluteal tendinopathies and trochanteric bursitis and more diffuse aspects of pain in that region. If you suffer from that, or you find that attempting long lever work in side lying positions elicits that sort of burning pain in the bony prominence on the hip, or you're just left feeling really uncomfortable after it, it's an absolute no-no for that, because it can be highly counterproductive and very kind of provocative for people's symptoms. So if you have any of that sort of stuff, probably best to give this type of exercise a miss and focus more on the preparatory rehab side of things for managing gluteal tendinopathies and the like. Anyway, that's enough of the caveats out of the way. So let's get on with the tutorials for the leg lifts. As I said, it's a side lying exercise, so I'll see you down on the mat. So here's our start position for the leg lifts. If you're not sure how to set up your side lying posture, then have a look at the video I've done on that, which goes through some of the fundamentals there. Essentially, it boils down to making sure that you've got a little gap underneath your waist so your spine is parallel with the floor, rather than sinking into that banana shape where the spine sags between the hips and the shoulders. Nice neutral alignment, drawing in those core muscles to help support that, and your hand supporting in front of you. Now, the leg lifts are different from the lift and lower in that there's not a huge leg movement. The final level focuses on using both legs at the same time. So before we get there, we want to make sure that each leg has the capacity to do lifting itself. Starting with the top, take a breath in to prepare and breathe out to float your top leg to hip height, and then inhale to come back down. As you're performing this movement, we're looking for the same sort of principles you get in the lift and lower, dissociation of movement, just bringing that leg up and down wholly independently of the body. So we're just getting that lovely dissociation of movement for the gesture leg. Try thinking about reaching the toes to the wall away from your head so that you're stretching out away from the body rather than thinking about lifting. You certainly don't want any collapse or change in the alignment of your spine or pelvis. So there's the top leg lift, a nice simple movement. Don't need to do too many repetitions, but we're just getting that lovely lift and lower just up to hip height. So it's that top leg lift. Make sure that you're not drifting into hip flexion and rolling the pelvis back when you perform that. Now, for assessing the bottom leg and doing the lower leg leg lift, we need to bring this top one out of the way. So I'm quite happy to just rest my leg on the floor in front of me. That quite often is not the most comfortable position for some people. So this is where a pillow underneath knee and or ankle, maybe just resting that top leg in a comfortable position that's neutral, will be what's required for some people. Don't worry if it's two pillows either, just get it out of the way in somewhere which is not going to become burdensome. Now with the bottom leg, there really isn't a great deal of range of movement that you're going to have. We're in a neutral leg and hip alignment at the moment. When we bring the top leg up away from the floor, it's moving into what's called an adducted position. So we're using the adductor muscles on the inside of the thigh predominantly, and as you come up, you're looking to get that dissociation of movement. Now this is where it's going to be much more challenging for some people, because the inherent range of adduction from neutral is going to be quite small. A number of things will tend to happen when people try this leg lift. One is the collapse in that midsection. You lift up, you think, oh, I'm not going very far there, and you tilt the pelvis and you can get all that extra movement. So because of that, it's quite good sometimes, particularly when the leg is offering support in front, to slip your top hand underneath your waistline, and as you go up into your lift make sure that there's no bearing down upon that hand with the lower part of your torso. The second thing which I see a lot of in this is that the bottom knee goes from a nice straight position to a bent position, and the hip rotates, and you get this false movement happening where the heel lifts, but the hip joint is not really doing what it's meant to. So I like to tell people to squeeze the knees straight at that bottom leg, to engage their quadriceps, to get that knee pushed back a little so you can feel the tension, to reach to the end wall, so that actually you get that sense of the knee just lifting off the floor slightly already, and then stretching and reaching to that end wall. So you're in a nice strong position with all of those leg muscles contributing. Exhale as you perform your leg lift. Inhale as you come down. I'll talk through a nice modification now. Because we have these things called muscle slings in the body, the adductors of one side, on one side of your body, in the inner thigh, work in conjunction with the external obliques on the opposite side of the body. So as I lift up, I'm actually utilising this anterior oblique sling or this posterior oblique sling, whichever way you look at it. It's coming in and utilising that connection between these diagonals. So what can be a really nice technique is if you push down into your top hip with the end of your forearm just above the wrist and push into that, that pre-engages the external obliques on this top segment, and then you can utilise that and get that extra facilitation of that diagonal sling of muscles. So that can, if you want, you can put a little towel between your forearm and hip, and that can give a nice little extra bonus and a little bit more accuracy in how you're doing these movements. Now, whether it's the top leg lift you're performing or the bottom leg lift, make sure that your movements are slow and intentional and you're not lurching and jumping up. If you find that you just can't do it, then perhaps leave one aspect of the leg lifts out and practice on the ones that you can. Now, moving on to the final level, gets a little bit more challenging here. We take a breath in to prepare, we breathe out to bring the top leg up, and then we breathe out to bring the second leg up. We then lower both down together. Now, to do this movement and really dissociate the leg movements from the upper body will be difficult for some. So squeeze that top knee and then extend and stretch and reach that leg away from you as we discussed before. And the same prep for the bottom one. Squeeze that knee and then reach and lengthen. But you're doing that without the pelvis moving, which is, as I said, pretty difficult. If you want to make it more challenging, bring that hand onto the pelvis so you've removed your base of support. And then as you do that, you've not only got the difficulty of bringing both legs off the floor, but you've got the fact that your body will want to roll forwards and backwards. And if you sense any movement at all in that pelvis or the top elbow or arm, you know that you're not quite at the level you need to be in terms of the core stability. So with the leg lifts, smoothness, control, intentional movement is paramount. Because if you come up and you find this just you're having to lurch up, it's not a good pattern to get into. So with those leg lifts, because it's long lever exercise in a sideline position, there's a lot of force going through the lateral hip structures particularly. So that's why I gave those caveats at the beginning, that you need to make sure that you don't have any of those acute issues going on. The other thing that will tend to happen is you might fatigue very quickly, whether or not you've got any of that stuff going on or not. So think about this concept of optimal loading. If you feel like you're working super hard and you're pushing to points of fatigue, you've already gone way past where you should be practicing. If it's just a few repetitions, they need to be good quality, they need to be pain-free, and they have to have that beautiful control all the way through, as if your legs are just being lifted up by water and you're executing that beautiful control for each aspect of your leg lifts. Don't worry if you can't do the last level. Practice with the top, and if it doesn't work first time, that's why we practice. Just make sure that you're keeping things sensible and that you're not putting too much pressure through those hips as you perform the leg lifts.